And now for the main event, Michelle, do you want to share an update on the environment and choices available for those eligible for Medicare?
Yeah, I'd be glad to, David. I appreciate your introduction. So the purpose of this is to just, as David was saying, give you a little bit of background about Medicare. Our timing is because we know that the Medicare annual enrollment period is right around the corner, and everyone eligible for Medicare is getting deluged, both with mailers, with robocalls, with all kinds of things. So we're trying to give you a few tools before the attack starts in October to make you feel more comfortable with what your options are, and to let you know that through David, you've got some help. You don't have to try to go this alone. So Medicare Made Clear basically is our topic. And I like to start with a test instead of end with a test. I know since we're doing video, you guys can't fully participate, but if you want to just kind of look at that slide, who was the first person to sign up for Medicare? And usually when I'm doing this live, everybody will say LBJ, but it's not.
It looks like him.
It does look like him. Who's the gentleman sitting next to him? Anybody remember? Give him hell. Harry?
Yeah, Truman.
Really?
Yeah, Harry Truman was the first person to sign up for Medicare, and the premium was a whole $3. It's changed a little bit since then.
Yeah.
All right, so normally when we talk about things, we talk about the ABCs. But with Medicare, we got to add one more letter. We need D in there. So this is where a lot of people get lost because it tends to become alphabet soup. So the only two parts of Medicare that you enroll in through the government are A and B. A is the hospital part, B is the doctor and all your outpatient expenses. Everything else is outsourced to the insurance company. So a lot of times people will ask me, well, how do I enroll in D? How do I enroll in C? Well, you don't. You just enroll in A and B through Social Security when you're ready to do that. Then we will help you with the rest of it as far as your actual insurance plans. Let's see if I can just do a page down. That'll be easier. There we go. Okay, so enrollment windows. A lot of people get confused with this. We were actually just talking a little bit before our meeting started about people working past age 65, which has pretty much come to be the norm. A lot of people don't retire at 65 anymore. So on reaching age 65, you can enroll in your Medicare 3 months before, or your birthday month, or 3 months after. So you've got a pretty full window where you can do that. If you're going to stay on your group insurance plan, you may not want to exercise that option, or you may just want to enroll in part of Medicare, which we'll talk about in a little bit. The other option is, let's say you work past 65, now you're 68 or 72, you want to leave your group insurance plan and go on Medicare, you have another window for you, and it's within 8 months of leaving your group insurance plan. So you've got plenty of time to do that. Everybody worries about, if I don't enroll at age 65, am I going to have all kinds of penalties? And the answer is no. As long as you've continued on your group insurance plan, you don't have to worry about any late enrollment penalties. And most people will start the process of enrolling in their Medicare usually a month or two before retirement. It's not vital, but that's kind of the best timing to do that. If you have missed both of those enrollment windows, you end up in a mess. So you want to make sure you're using one of the first two. The general enrollment period for Medicare is every year, January through March. During that time, you don't have to have a reason. You can enroll in your Medicare, but it won't start until July of that year. So you can end up being in a giant hole without Medicare if you wait until that general enrollment period. So you want to try and avoid that. Okay, so what does Medicare cost? Medicare Part A is the hospital portion. There's no premium. It's not free. It's not an entitlement. All your life, when you've paid FICA or self-employment tax, think of it as making the mortgage payments on your Medicare Part A. So it's paid off at age 65. Medicare Part B, which is the doctor and outpatient portion of Medicare, does have a premium. It changes a little each year, For this year, Part B starts out at $170.10 per month. It can be higher than that. So for people who have had higher incomes, it can be anywhere up to around $450 a month. Now you have to have a very substantial income before it gets that high. Most people, it's going to be around $170 to maybe $250 a month for your Medicare Part B, depending on your income. So if you're working past 65, a lot of people will enroll just in Medicare Part A because there's no premium for it, and they'll stay on their group insurance plan. You do not want to do that if your group insurance plan is an HSA plan, a health savings account plan, because what happens, even if you just enroll in Part A, you can no longer make contributions to that HSA savings account. So there's no point in being on the plan if you can't take the benefits from the savings account. So if you're in an HSA plan, don't enroll in any part of Medicare. If you enroll in Part A and B, then you then can use supplemental coverage if you're going to leave the group plan. All right, who's on first? This is Abbott and Costello time to wake everybody up. So if your employer has 20 or more employees, your group insurance remains primary, your Medicare is going to be secondary. So what that Medicare Part A is going to do is it basically is going to pay as secondary coverage if you have a hospital claim. So it's good to have the Part A set up. If you're with an employer that's got 20 or more employees, you're eligible for Cobra. You never want to take Cobra if you're eligible for Medicare. For one thing, with the Cobra, it becomes secondary coverage, and most people don't understand that. So if you have not enrolled in your Medicare Part B and you go on Cobra, your Cobra says, we don't care if you enrolled in Part B, we're still only going to pay as secondary. We're only going to pay 20% of your medical bills. And most people do not realize that. Even a lot of HR people don't realize that. I had a gentleman call me one day, and his wife was having ongoing treatments at MD Anderson. So they were concerned. They thought, well, the best thing is to stay with the group insurance. So they took Cobra. They got a bill from MD Anderson for $96,000 because the Cobra was only picking up 20% of her treatment. So I tend to harp on this because of that phone call. I don't ever want to see anybody in that position. So the bottom line is, if you're eligible for Medicare, never take Cobra. All right, to be or not to be, another wake-up call here. All right, so again, if your Medicare is going to be secondary to your group plan, you don't need Part B, you're just wasting money, don't enroll in it. It can be added without any late enrollment penalty within 8 months of leaving your group plan. And I think I mentioned the Cobra thing, but I'm going to say it one more time. You've got to add Cobra, or I mean, you've got to add Part B within the first 8 months of Cobra, but the best thing is never to go on Cobra. All right, so you're getting all these flyers, and it's all these different kinds of plans. Buy this one, take that one. This one's wonderful. This one's better. And you get to the point to where you just are frozen. You don't know what the heck to do. So let's talk about the different kinds of plans. The basic choice is, once you've enrolled in your Part A and your Part B, whether to enroll in a Medicare Advantage plan or to enroll in a Medicare Supplement plan and a Part D prescription drug plan. Neither one is right or wrong. It just depends on your individual situation. So it's kind of pay me now or pay me later. With a Medicare Supplement plan, you're on the pay me now version. You're going to pay a premium up front, and then you have very little out-of-pocket expense. With a Medicare Advantage plan, it's just the opposite. You're on the pay me later plan. So you see them all advertised, 0 premium, we're going to give you the moon. I think by the time we hit 65, we figured out there's more behind that curtain. So the way Medicare Advantage plans work is you typically do not pay a premium, but then you're paying on the back end. So as you have medical treatment, you're going to pay copays, which are outlined in the plan. So I'm not saying these plans are bad, but it's just very important to read past zero premium and know exactly how they're going to work, know what the copays could potentially be. All of the Medicare Advantage plans have an out-of-pocket maximum. They have a safety net. So just like you've been accustomed to on group insurance, they will say, these are your copays. However, if they ever total X amount, then for the rest of the calendar year, you don't pay anything. And typically for the HMO plans, that's going to be around $3,500 for the calendar year. The PPO plans are going to be much higher. They're going to be around $7,000 for the calendar year. So even though everybody thinks they like PPOs, the HMOs will typically have much richer coverage and much lower out-of-pocket maximums. So with a Medicare Advantage plan, you're now in Medicare Part C. We talked about A being hospital, B being doctor, D for drugs, which is the only part of Medicare that makes sense. So we've skipped C. Well, C is Medicare Advantage plans. So when you enroll in a Medicare Advantage plan, you are now in what's considered to be Medicare Part C. Think of it as C for the combo plan, because that's exactly what it is. I'm sorry, I'm getting some buzzing and I don't want you to have to hear that. So when you enroll in a Medicare Advantage plan, everything gets combined into one piece. So you don't lose your Medicare Part A and your Part B benefits. They just become absorbed into your Medicare Advantage plan. So they're still there. Your Part D drug coverage becomes absorbed, it's in there. And then they add additional coverages. So you end up using one ID card for the Advantage plan for everything you do. Hospital, doctor, lab, drugstore. You're just going to use that one ID card for everything. You're going to have zero premium or a very low premium with the Medicare Advantage plans. You pay your copays. You have a service area that you need to stay in for routine care. So these are scheduled things. I'm going to go to the doctor. I'm going to have a test done. I'm going to have a surgery, etc. When it's a medical emergency, the service area is waived. So if you're visiting your grandkids in Wisconsin and you're having some chest pains and you go to the emergency room, or you fall and hurt your knee, whatever it might be, you don't have to worry about the service area or the network whenever it's emergency treatment. It will always be covered just like you were in the network. When you're in your normal service area, you'll have hospital and doctor networks. Some plans have better networks than others. So the very first thing you want to look at is the network. You want to give us a list of your doctors and let us see if they're in the network. Let us know what hospitals you would prefer to use. Let us see if that hospital's in the network. And one giant disclaimer is MD Anderson does not accept Medicare Advantage plans, period. So if you have a history of cancer in your family, we're always going to advise you not to take a Medicare Advantage plan, because most people in the Houston area are going to want to go there should that happen. So just be very aware, you're not going to see it even in the fine print on all these brochures you're going to get on Medicare Advantage plans. MD Anderson will not accept them. They will only take Medicare supplement plans. Now, Methodist has great cancer treatment. Memorial does. MD Anderson certainly is not the only place in Houston, but they're the place a lot of people would prefer to go. So be aware of that. On the plus side, people who typically enroll in a Medicare Advantage plan are people who are very healthy. They see a doctor once or twice a year, and they're sitting there going, well, why should I pay $2,000 or more in premium for health insurance to see a doctor once or twice a year? Which certainly makes sense. So for a lot of people, the Medicare Advantage plans are a good option. But again, the reverse side of the coin is with a supplement plan, you don't have the limitations on where you can be treated. So Medicare supplement plans. Now we're flipping the coin over and we're looking at the other option. This is the Pay Me Now plan. So you're going to have a fixed monthly premium. For someone age 65 in the Houston area, you're probably looking at about $140 a month, give or take. It depends on smoking status, age, a few different things, but that's kind of a good ballpark. Then you would also need a drug plan. So if you want to ballpark about $200 a month for your supplement plan and your drug plan premiums combined, that's going to be a pretty close comparison. You're going to pay that Medicare Part B premium no matter what kind of plan you enroll in. So whether you enroll in an Advantage plan or a supplement plan, it doesn't make any difference. You're still going to pay that Part B premium. Think of Part B and Part A as being the foundation for the house. No matter what you do, you've got to lay the foundation. Now we're talking about what kind of house I want to put on top of it. Do I want an Advantage plan or do I want a supplement plan? So if with a supplement plan, I don't have co-pays, I don't have co-insurance. The only out-of-pocket I have for my medical expenses, other than prescriptions, is my annual Part B deductible. For this year, the Part B deductible is $233. It changes a little bit each year, but it doesn't change much. So next year it might be $237 or something. We never know till October, but it's not going to change much from year to year. So with Supplement Plan G, which is the plan that everyone enrolls in now, you just pay your annual deductible and you're done. Medicare pays its portion. The supplement plan picks up the balance. You don't have any service area limits, so you don't have to worry about, well, if I'm in Wisconsin or I'm in New Jersey, am I in network? How's this going to work? You're covered anywhere in the US. You don't have to worry about it. You don't have a doctor network. So if you're looking at supplement plans and 2 of your doctors are in the network, but the third doctor isn't, then it might make sense to do the supplement plan if that third doctor is somebody who's really important to you and you want to continue to see. With the Medicare supplement plans, you have what's called open enrollment within 6 months of your Part B effective date. So what that means is you enroll in your Part A, you enroll in your Part B, you can enroll in any supplement plan that you want with no health questions. That's a one-shot deal. So it's extremely important that you pick the right Medicare supplement plan. Once you've used that initial enrollment, that's gone. So if you decide to go with Fly By Night Mutual because they're $30 a month cheaper, and then on the first renewal, Fly By Night Mutual doubles your premium, and you now want to go to a different carrier, you have to answer health questions and you have to go through medical underwriting. They don't have to take you. They can charge you a higher premium. So because of that, we are extremely picky about what supplement plans we will provide. And the only two that we use are AARP United Healthcare and Blue Cross Blue Shield. We know those two carriers are top quality. They pay claims. The doctors and hospitals all accept them. We never have problems with our phone ringing saying they're not paying my claims or they doubled my premium. So those are our tried and true blue chip carriers that we use because we know that those are carriers that you can be with for 20 or 30 years and you're in good hands. So that being said, you've got that special enrollment period when leaving your group plan. We were talking about people who just enroll in Part A and they postpone their Part B until they're ready to leave the group plan. The open enrollment window is based on your Part B effective date, not on you turning 65. So if I'm 72 and I just enrolled in my Medicare Part B because I'm leaving my group plan, that's when my 6-month window starts, that I can enroll in any supplement plan I want without any health questions. Okay, for those of you who are still awake, let's talk about Medicare Part D. Again, D for drugs. So they don't have to be with the same carrier. You might have your Medicare supplement plan with AARP United Healthcare. Your drug plan might be with Humana. They're completely separate. So in choosing a drug plan, the first thing to do is totally ignore the premiums. What you want to look at is your particular medications. And again, you're going to get tons of junk mail during the annual enrollment period every fall saying this is the best drug plan. Well, it's the best drug plan if it covers your medications at the best copays. So one of the things that we do is we ask you for a list of your specific medications. We then go on Medicare.gov, input all that information, and it will tell us which drug plan is going to be the least expensive. Sometimes it may be a drug plan that has a higher premium, but because of that higher premium, either it doesn't have a deductible or it has a lower deductible or it covers one of your real expensive medications. So don't go by the color of the pretty brochure. You need to look at your specific medications on this. You enroll in Part D through the plan. So again, this is not through the government. Whatever plan you choose, that is your Medicare Part D. The formularies and the copays vary significantly from plan to plan. Usually the lower premium drug plans are not going to cover very many of the expensive medications that you see every third commercial on TV at night. So you need to look at that very carefully. The part of the drug coverage that is very confusing to people is what's called the coverage gap. Some people call it the donut hole. Same thing. Let me try to take the mystery out of it. All that the coverage gap does is it says you can buy up to X amount of medication and your plan is going to pay the way we said. Here's your deductible, here's your copays, etc. Then Medicare draws a line each year and they say, okay, if you buy more than this amount of prescription medication, for this year, that line is set at $4,430. So if you don't get to that line, doesn't matter, it's a moot point. If you cross that line, if you don't do a Johnny Cash and walk the line, but you cross that line, all that happens is you now pay 25% of the cost of your medications. Very simple. They make it so complicated in these brochures. So if you buy more medication than that during the calendar year, you're going to go to the drugstore one day and instead of the copay you've normally been paying, they're going to give you an odd amount that just tells you that you've crossed that line and you're now paying 25% of the cost of your medications for the rest of the calendar year. Every January it resets. You start at the beginning again. There's a second level that very few people reach, and that's called the catastrophic level. Now, instead of looking at the total cost of your medications like we were on the first number, we're looking at just what you actually spent. So what you spent in your deductible, your copays, your 25%. It's the opposite of the Capital One commercial. It's not what's in your wallet, it's what's left your wallet. So if you reach a point during the calendar year where you personally have spent $7,050, that 25% you've been paying drops down to 5% for the rest of the calendar year. So I know that's a lot to absorb, but just be aware that there may be a point, typically toward the end of the year, where your copays change. And if they do, that just means you hit the coverage gap. If some fly-by-night person tells you, oh, that won't happen with our plan, you want to immediately hang up because this is federally mandated. Every single drug plan has to work that way. If you do a Medicare Advantage plan, it has to work that way. There's no such thing as it going away. The good news that the light at the end of the tunnel is, with the new legislation that was just passed, this is going to reduce significantly in 2025. So we've got a couple more years to deal with this, but in 2025, there'll still be a coverage gap, but it's going to be around $2,500 instead of what you're looking at here. It's going to significantly reduce for everybody. So if we can hold our breath for 2 more years, we'll be out of the worst of this. But again, for most people, it's just the last couple of months of the month, if that they hit the coverage gap. Okay, annual enrollment period. This is why your mailbox is already starting to get full. It's why you're going to be getting a bunch of robocalls. Every year in the fall is what's called the annual enrollment period for Medicare plans. During that time, you can enroll in a Part D drug plan or a Medicare Advantage plan for the first time, or you can change those plans. There are no health questions. So perhaps your doctor's put you on a new medication and it's not in the formulary for your present drug plan, or maybe it's at a very high copay on your present drug plan. You want to shop that, you want to come back to us, let us look at it. In October, we can see the new drug plans for next year, and we can see the drug formularies for the next year. So we can do the same exercise again for you and see, based on the medications you're taking now, what is going to be the best drug plan for you for next year. Maybe you're in a Medicare Advantage plan and you want to change your doctors, or one of your doctors has left your plan network. We can look at Medicare Advantage plans for next year and see what's going to work for you. Any plan change that you make will be effective January 1, because these plans are always calendar year plans. One thing I do want to point out, and a lot of people get confused by this, Medicare supplement plans are not part of the annual enrollment period. A lot of people think that they are. So let's say you had tried out a Medicare Advantage plan and you're not happy with it. You want to move to a Medicare supplement plan. Medicare gives you a 1-year test drive. And they say if it's the first time that you went in a Medicare Advantage plan and you are changing your mind, you have up to 12 months to move from the Advantage plan to a supplement plan without any health questions. So you have a chance to try it out, see if you like it or not. Once that 12 months is up, yes, during the annual enrollment period, you can change from a Medicare Advantage plan to a Medicare supplement plan, but you're going to have to go through medical underwriting. So you may be able to change to a supplement plan. You may not be able to change. All depends on your health. Obviously, from an underwriting standpoint, they're going, why does this person want to start paying a premium now? So they're going to be really looking at it with a fine-tooth comb. So if you think you want a supplement plan, either do that from the beginning or change within the first 12 months if you try the Medicare Advantage plan. Once that 12 months is up, you've got to go through medical underwriting. Okay. There's one last open enrollment period, and that's January through March. That one is just for people who are on Medicare Advantage plans. The reason for that second window is sometimes doctors won't decide if they're going to recontract with Advantage plans until right at the end of the year. So they send a notice out in January to their patients saying, we're no longer going to be in the XYZ Medicare Advantage plan. Now that annual enrollment period is over and you can't make a change. So Medicare said, okay, we need a second window for people when that situation comes up. So there's a second window, January through March, where if you're in a Medicare Advantage plan, you can change to a different Medicare Advantage plan, or you can go to a supplement plan. But again, going to that supplement plan, you've got to answer health questions. They may take you, they may not. So there's no guarantee that you can go to a supplement plan. There is a guarantee that you can go from one Advantage plan to another Advantage plan. So just bear in mind, if you're in one of those plans, your doctor leaves the network or a hospital leaves the network, you have an additional window. You don't have to wait until fall of the next year to change that plan. A lot of people, again, are working past 65. They're trying to decide Should I stay on my group insurance, or should I move to a Medicare Advantage or Medicare plan? So the simplest thing is to just literally draw a line down the middle of a sheet of paper. I'm very technology impaired, so I still use paper. On one side, you want to look at your group plan, and you want to get with your HR person, find out how much premium is coming out of your check. And if it's husband and wife, you want to have that broken out separately. What's my deductible and my co-insurance? If I go in the hospital, what am I going to spend? What's my out-of-pocket maximum? And then you want to look at, on the other side, if I do a Medicare supplement plan, what's my premium going to be? If I do a drug plan, I want to look very closely at that if I have expensive medications. How am I going to come out on my drug cost on a Medicare drug plan versus on my group plan? A lot of times it's very similar. Sometimes if you're going to be in that coverage gap, it might be better to stay on your group plan. Or I can also look at a Medicare Advantage plan where I'm going to have low premiums and copays. I'll pay co-insurance, and I'll compare the two. And that's something, by the way, we will help you. This is just to give you an idea, but we will help you sit down and figure that out. Last thing I want to talk about is his and hers. So a husband and wife do not have to go with the same plans. Typically on group insurance, the employer is not paying as much of the premium for the spouse as they are for the employee. So it may be that it makes sense for the employee to stay on the group plan because the employer is paying all the employee's premium, but for the spouse to go ahead and go on Medicare and a Medicare premium or Medicare plan because they have a higher premium on the group insurance. So that's one thing you want to look at. The other thing is you don't have to like the same plans. So you don't have to get in a fist fight over it. One of you may want an Advantage plan. The other one may want a Medicare supplement plan. That's perfectly fine. You each have your own coverage choices, so you don't have to be on the same plan. And then also the younger spouse, if they're not 65 yet, and you are on a Cobra plan, the younger spouse can go on Cobra. And a lot of times that'll take you up to the point where the younger spouse is 65. Or if not, we can look at individual plans for the spouse if it's not a Cobra group. So there's a lot of things to look at when there's a husband and wife, if one's not Medicare age or if both are Medicare age. So all of these things you don't have to know. That's our job to help you sort all this stuff out. But again, the whole purpose of this is just to give you some ideas so that when you start getting deluged in the fall, you kind of are pre-armed and you know what you're doing. One last thing I will add as far as open enrollment is agents are not allowed to call you without your permission, but there are tons of them that do. So if you receive a phone call and it's John Jones Insurance Agent and they want to help you with their Medicare, that is an illegal phone call. That is not someone that you want to be dealing with. That is somebody sitting in a call center and they're just calling phone number after phone number. They want to shove you in a plan and you'll never hear from them again. So do not take those calls. If you want to have a little fun with it, and I've sat with somebody when they did this, when they finished telling you all about how wonderful they are and their plan is, simply say, may I have your license number to report you to Medicare for soliciting? They will never call you again. It's a great way to get rid of them. But the best thing is just not to take those calls. So that's pretty much what I have. Hopefully we have some chat questions because this is really boring just listening to me nonstop. So do we have any questions anybody would like answered?
Yeah, I've got some questions, or actually comments, both.
Okay.
I have been on Medicare for a number of years now.
Mhm.
I'm on Plan F, which you can no longer get.
Correct.
And it's very expensive.
Yep.
And it is possible that I could change. My health is fairly well, My wife, on the other hand, has multiple sclerosis. And they had talked to us about moving to Plan G, but then we both talked about she would have to go through the health screening, even though, and they're both with United Healthcare, the ones you recommend through ARP.
Correct.
And the odds of her getting through, even if you just change those plans within the same company, my understanding is you have to do the health screening as well.
That's correct. So she's not going to be able to change her plan.
Yeah, that's
She
what I
needs
thought.
to stay on Plan F.
Yeah,
You, on the other hand, if you're healthy, should apply for Plan G. The only difference between Plan F and Plan G is with Plan G, you pay that little $233 deductible. Big
yeah.
deal. But that is the only difference between the two plans. If you can move to Plan G, you should. And we're working with a lot of our clients on Plan F to move them to Plan G if they can move, okay? What is happening is 2 years ago, the door got shut on Plan F. So as of 2020, no one new to Medicare can enroll in Plan F. So once that gate is slammed shut, you don't have any new 65-year-olds coming in anymore. So what's happening is the average age of the policyholders with Plan F is just getting higher and higher and higher. So because of that, those rates are jumping. And you're not getting any new healthy people coming on, which is causing the rates to jump. So unfortunately, Plan F has become a dinosaur, and it's going to just keep going up and up on the rates. If you can move to Plan G, do it. I realize your wife can't change, but at least we can help your premiums. And we'll be glad to help you do that.
Okay, can you stay on your current plan while you're going through the process of seeing if you qualify?
Definitely. Yeah, definitely. You never cancel your current plan until they come back with their offer. So they will either come back and say, you're accepted at standard rates, in which you say, great. You take the policy and then they will cancel the old one. Or they may come back and they'll say, well, we'll take you, but you're going to have to pay a higher rate, in which case there's no point accepting that. You may as well just stay on Plan F. Or they may say, sorry, you're not eligible. We're declining your application. So you don't want to cancel what you have until you've received their offer and you can see, yes, that's going to be better. I'll take that plan.
Okay.
And you don't have to worry, by the way, about them saying, well, shoot, we're going to cancel that other policy. We don't want this person. They cannot do that.
Yeah. Well, it definitely has went up in price. It's over $250 something a piece for that plan. So
Well, that's our government helping us. What can I tell you?
yeah. Have one other quick question on the drug plans. Is there a mandated government deductible before the drug plan kicks in?
Yes, Medicare mandates the deductible every year. For this year, I want to say it's $430. I've already got next year starting to come into my brain, so I get lost here. But Medicare mandates the deductibles, and all the drug plans, if they're going to have a deductible, typically have to have the same plan. Now, United Healthcare somehow came out with a kind of a hybrid drug plan that they introduced this year. It's got a little bit lower deductible, and it's offset by the way they set up their coverage tiers. I don't know how they got away with that, but they did. But normally, all the drug plans have the same deductible. Typically, the plans that have a real high premium will waive that deductible. Or they might at least waive it on, say, tier 1 and tier 2, maybe tier 3 drugs.
Okay. Yeah, I've never met the deductible on mine to ever draw anything from it. And my wife has oftentimes went into catastrophic. So
Okay.
I've
So
got
it sounds
experience
like
it
your
all.
wife is probably where she needs to be as far as her coverage.
Yes.
I would suggest you let us shop your drug plan this fall,
Okay.
because there are a lot of plans where if you're just taking generics, the deductible's waived. So I think probably we should change your drug plan for next year.
Okay. That's all my questions.
Okay.
Could I jump in with a question, Michelle?
Please.
I know your Medicare premiums can be adjusted based upon income. Does if somebody, say a business owner, sells their business and they have a spike in income the previous year, is there a way to get Medicare to adjust those premiums, a way to kind of dispute that this is a one-time event, not an every year event?
Unfortunately, they don't have a disclaimer for that. There is an income adjustment form, which I can send if you need it, but it has 4 or 5 different categories on it where they will consider changing it. Retirement is one of them. Selling a business isn't. It should be, but it isn't. And so a lot of times we'll have people who they've gotten a big bonus, or they've had a new business or something like that. They don't allow for that. There's death of a spouse, divorce, retirement. They're just pretty much major life changes that they will look at it earlier. The good news is they look at it every year. So in 2 years, you'll be past that if you don't have a qualifying event. So each year in January, you should get a new notice from Social Security saying what your Part B is going to be for next year. It's always based on your tax return from 2 years prior. So anyone in 2022 who's in Medicare, 2020 income is what they're looking at to determine your Part B premium. So eventually it will go down, but it takes a couple of years unless you have one of those qualifying events.
Okay. The other question that didn't get raised yet, does Medicare cover assisted living costs?
Not really. Medicare will cover skilled nursing care after a 3-day hospital stay. So for someone, maybe they've had a surgery or they've had something significant that they were in the hospital more than 3 days, and they moved to a skilled nursing center for a while. Medicare will cover that for up to 100 days. If it's just assisted living, Medicare does not cover that. If it's home health care, Medicare will cover a certain number of visits. They will look at it on a month-to-month basis to see what kind of progress you're making. Those kind of expenses were never designed for Medicare to handle. That's where long-term care insurance comes in, or a short-term recovery care plan, which we are working with a lot of those because long-term care insurance is becoming very, very expensive. The carriers sold a ton of that about 10 years ago. Now they're all panicking because they know all those claims are going to hit at the same time. So as a result, most of the carriers don't sell long-term care insurance anymore, or they've made it almost impossible to get. So if you have a long-term care insurance policy and they've raised the premiums, say thank you and mail them a check. Don't ever let go of it. You may want to adjust the benefits a little bit if you need to, but never drop it because you're not going to be able to get that kind of coverage again. That's what takes care of assisted living, home health care, nursing homes, all that kind of thing. There are home health care plans that are for up to 1 year. And that's something I highly recommend looking at. We'll be glad to help with that. Most people want care in their own home, and that's what they're designed for someone to come to your home, help with things like bathing and meals and custodial care, nursing care, whatever type of expenses you need, and they're for up to 12 months. They're much less expensive and they're much easier to qualify for as far as medical underwriting.
Okay, thank you.
Do we have any other questions for Michelle?
Yes, I do.
Go for it.
I taught high school and coached football, and then at age 57, retired after 34 years. So I went on TRS care, and when I turned 65, I just rolled over to the TRS Medicare Advantage. But I'm not convinced that theirs is a very good Medicare Advantage plan. There's still $135 a month premium, $500 deductible, copays. So, and as far as drugs, I take 3 prescription drugs, all generic, and that's it. So would I be better off switching to a supplement plan?
Yeah, the TRS plan, I'm very familiar with it. I have a lot of teachers that I work with. It's great if you're on super expensive medications, because as an employer plan, they're able to get rid of that coverage gap. So that's why you're paying the high premium for that plan. You're paying for a plan that doesn't have the coverage gap for the medication side. If all you're taking is a couple of generics, there's no reason to do that. So you might want to look at either switching to a different Advantage plan, which wouldn't have that high premium, or going to a Medicare supplement plan. But again, you'll have to answer health questions. But they're basically looking for the chronic conditions, heart, lung, cancer, or those kinds of things, okay? So if you're able to answer no to all of the health questions, typically you can move to a supplement plan. So that's something we'd be glad to look at in October for you.
And my only medications are for blood pressure and thyroid.
Yeah,
Only-
there's no reason to be paying that much to cover that.
The only health issue I ever had was 3 years ago. I had bladder cancer, which they took care of, and I'm in remission, go back once a year, and they never find anything.
Okay. Typically, the cancer question is going to be 5 years. So what you're more likely going to want to do for now is move to a different Medicare Advantage plan. So you're not paying that high premium, and you're also going to have a lot bigger doctor network.
Okay, thank you.
You're welcome.
Hi, Mary Skaggs has a question.
Yeah, hey,
Go
Mary.
ahead, Mary.
Hi, everybody. I'm seeing ads on TV.
If you say Joe Namath, I'm going to scream.
No, that's not one of my faves. You know, the ones, well, they're all saying, hey, check because there's new possibilities of things that you're not capturing, you know, we'll check. Of course, I know that's a marketing ploy.
It is.
But
It's
one
not
of the
fun.
interesting ones that they mentioned was getting some kind of money back or monthly.
I know that these commercials, Medicare is finally starting to crack down on them. And they passed a new rule that starting with the annual enrollment period this fall, that all those numbers that they tell you to call, they have to record those calls. And they're all
I would
panicking
never
about it.
call them.
Yeah,
Okay, I
well,
get
I'm
enough
glad to
calls.
hear that. I really am. Because these are just these call centers and they'll tell you anything.
Right.
That is all completely bogus. A
Mhm.
lot of those commercials ask for your zip code because they want to see what area you're in so they can plug you into an agent. The only way that you get that so-called money back thing
Yes.
is if you're on Medicaid, which
Oh,
means you're
okay.
at the poverty level. They do
Well-
not tell you that in those commercials. They're
I
so
gotcha.
misleading. And that is nothing new. It's always been that way. These commercials are just ridiculous. I am amazed that Medicare has allowed them to go on with this as long as they have. And I'm hoping they're finally going to crack down on some of the things that they can say in those commercials. There is nothing new. The fact that they're allowed to say that amazes me. You know, as agents, they hit us with a fine-tooth comb. You can say this, you can't say that, and yet they allow these commercials to be so misleading. It's just absurd. There's nothing new. They're not going to pick up your Part B premium. They're not going to send you free money. It's just horribly bogus advertising.
I want free money.
I do too. When you find that, would you let me know?
Sure. Thanks for answering my questions. I enjoyed your presentation.
Thank you. You're welcome.
Ariel, did you have a question? I see your hand up.
Yes, I do. I am
Okay, go ahead.
a retired educator. I'm on the TRS Medicare Advantage,
Mhm.
which of course I pay the high premiums for.
Right.
A pretty healthy guy, and you know one thing that bothers me is I see these commercials on TV with, offering coverage for 0 premiums.
Mhm.
I wonder, why not leave my Medicare Advantage with TRS and go into like Kelsey Siebel. I see Kelsey Siebel offering, 0 premiums. Would it make sense for me to do that?
It probably would. Bear in mind that once you leave the TRS plan, you cannot go back. But again, the only reason to be in the TRS plan is if you're on very, very expensive medications and you want to avoid the coverage gap. That's the only reason to be on that plan. That's what you're paying, that $135 or whatever a month premium you're paying to them. I work with the Kelsey plan. I work with a lot of the different Medicare Advantage plans. If that's something you want to look at, again, in October, that's when the Medicare Advantage annual enrollment period starts. And I can show you the benefits for the 2023 plan year, because that all comes out in October. And we can look and see if you want to make a change to that. Most of the Medicare Advantage plans are 0 monthly premium. The reason they can do that, remember we talked about Medicare Part C as being the combo plan for Medicare Advantage plans. So when you're in the Medicare Advantage plan, Medicare is not paying any portion of your expenses. The Advantage plan is doing everything. So you pay your Part B premium into the government turns around and they send that Part B premium to the Advantage plan every month. So they're receiving your Part B premium every month, and they're receiving your copays when you have care. So that's why they can offer 0 premium, because they're getting your Part B premium and they're getting your copays. So that keeps them financially stable. So yeah, I think it would make a lot of sense for you to look at that.
Okay. Well, when the time comes, send a message through Kai, because I was thinking, there must be a catch somewhere. How can they offer 0 premiums? Somehow they're going to be able to turn around and get you.
Well, some of them do, believe me. I know who's the good, the bad, and the ugly out there. That's my job to know that. Kelsey is very good. United Healthcare has a very good Medicare Advantage plan. There are a few that do a really good job.
With 0 premiums.
With 0 premium. So I'll be glad to look at that for you.
Definitely want to see you about that. Thank you.
You're welcome.
Any other questions before we sign off? All right. Well, Michelle, I just want to thank you so much. I know we went a little longer than we normally do, but there were some great questions. And I know that, we've recorded this. So if anyone wants to share this with their spouses or with their kids or friends, we will be sending this out via email and also have it posted on our website. So thank you. We really appreciate it. Please, call our office. If you have any additional questions for Michelle, or want to get in touch with her, you can either call the office, feel free to call me, Kyle, or David. And we will definitely get you in touch with Michelle, for anything that you need, coming up, before our annual enrollment. So thank you, everyone. Thank you, Michelle.
Thank you. I
And
appreciate
we
it.
really appreciate it. Thank you.
Bye-bye.